Welcome to 2024 and Happy New Year to everybody. You know, New Year means new beginning, and I am so excited to face 2024 with you all. So yeah, this would be an exciting 2024. So hi guys, I'll be discussing this very exciting case, a beautiful one, and a minimally invasive veneer procedure. So this patient is a 30-year-old female patient who went to my clinic with the chief complaint of having or wanting to have a longer sets of teeth. But she doesn't like to have super white, fake looking sets of veneers. So of course, it will be my honor to do that kind of procedure. So we are considering the health, the function, as well as the aesthetics. So in a subtle way, we have prepared the teeth. We took everything, the x-ray, the pictures, the clinical assessment before we start the case. So this patient actually had a braces, okay? She worn it for at least 2 years. The problem here, she doesn't like wearing retainer. Sabi niya, according to her, maliit ang teeth ko, gusto ko pahabain. So natural looking veneers and almost same shade ng natural teeth ko. Okay, so this approach is a dentofacial smile design wherein we consider the length of the teeth in relation to the face. We check the lips, we check the harmony, okay? We check also the buccal corridor, the arches, the relationship with the upper lower teeth, the bite, the occlusion, before we do the designing, okay? We have what we call dentofacial analysis, which is very important in my practice before we delve directly to the patient. But for her case, I did a smile design directly to the patient's mouth. So through composite, because I really want to check everything, the color, the height, the size, the shape, and the harmony. And because this is a minimally invasive case, minimally means I am not going to remove a lot of sound structure. Why? Because in dentistry, preservation and conservation of the teeth is our main priority, because you cannot put back what you have removed. We are making sure that everything should be within parameters. So with direct composite veneers, I can be able to check directly how much should I remove, or for me it's more predictable for her case. So as you can see here, it looks amazing with the design that they created. It's in harmony with the patient's face, and that's the most important. And also the patient likes it, because we need to ask the patient's permission before we can go straight to the preparation. Of course, mas maganda if meron siyang approval. Okay, that's the most important, because the patient will be wearing that smile for so long. So dapat confident and happy siya with the new sets of teeth. I actually gave the patient a little bit whiter than natural na teeth niya. And actually, she was happy with the design and the color. So I did the preparation, minimally invasive preparation, wherein I remove all demineralized area of the teeth as well, kasi we have to make sure that everything should be clean, free from bacteria, free from cavities, and as well as ensuring that everything should be done minimally invasive. So this is the final preparation. As you can see, I did not remove a lot of structure of the teeth, and it looks amazing. The margins is on point. We made sure that we have enough margin to avoid staining on that area, and also respecting the periodontal health. Usually when we do our preparation, we don't go inside the gums, or if we must go there, it should be within 0.5 millimeter, not beyond, because we are respecting the periodontal health, because we don't want to create something that is beautiful yet it's problematic. Okay, one of the problems with the veneers, kasi especially with the preparation, if we go too deep inside the gums, there's a potential danger to the periodontium, and if that will happen, the consequence would be on the patient as well as for the professional as well who made the veneer. That's why we are making sure that everything should be within limits, normal limits, ideal if possible. And we're not just protecting or changing the morphology, anatomy, but also we are protecting the health. We are establishing function as well. After the preparation, we have to make sure that we get the final impression. In this case, we have an intraoral scanner. We use the Prime Scan from Dentsply. This is a good machine that would get the final impression. Because it's detailed-oriented, we can be able to see all the margins without any problems. We have to get the bite registration as well as the face bow registration to make sure that we articulate it in a semi-adjustable articulator to make sure that the occlusion will be protected. Okay, and we are doing it the right way, the systematic way. So my own laboratory, I have my own laboratory, and my technicians are the one responsible for doing these beautiful ceramics. So they copy the design that I made and ensuring that everything should be stratified systematically. We have to make sure that the stains, the characterization should be on point. The translucency, to increase the value, to make it a little bit whiter but not fake white. We made sure that incorporate everything in gradually. So there's always a process when we do our ceramics, and it's a tedious one. It's not easy, but my team is really devoting themselves to making a very good and quality-based product. So we are confident that we provide these beautiful ceramics to all our patients. So after completing the lab works, we ask the patient to come back to our clinic for try-in. So try-in is very important. We need to make sure that it looks natural, it looks beautiful, and we made sure also na binigay namin what the patient requested, which is a little bit longer and a little bit wider. So this is the before and this is the after. Okay, as you can see the difference, there's a subtle changes. The height, not too crazy, not too big. The color, not too white within the parameter. Look at the color of the eye and look at the color of the teeth. Diba? Yun yung mga combination namin. And also, we are looking at the mid-face. Especially itong area to sa mid-face. We are considering that when we create our smile design. Kasi dapat babagay siya sa whole face. Okay? So, we are not giving the patient what she wants, but what is appropriate for her case, which is not just a beautiful but also functional, healthy sets of teeth. So notice that there's serrations, lines, translucency in there, because we want to make sure that we give the patient what's natural. Okay? So the serrations actually could create something mas buhay yung ngipin because of the small depressions, line angles in a perfect spot where we placed, and also right translucency as well as right amount of stain to make sure that it will blend with the other teeth. So yun. The embrasure also are on point. The distribution of the smile, it looks natural. The most important here is the health of the gums. As you can see, it's seamless. Hindi siya bothersome. And thereby, we can create a more healthy, predictable, pink, white, healthy dental aesthetics. We also check the occlusion, which is very important in this type of restoration, because it's not just about beautiful sets of teeth, it's about the functionality. We are making sure that the patient can eat, that the patient can actually use that beautiful sets of teeth. And we removed all the problems, the parafunctional contacts, the asymmetry in the height, and as well as establishing the proper occlusion. And after completing everything, we gave the patient a night guard that can be worn every night to protect the sets of teeth and protect from grinding. So that's very, very important to make sure that we protect our veneers as well as our natural teeth. Thank you very much for listening and for watching my vlog. I am so happy that I can do what I love to do and I can share what I love to share. Happy New Year!